Alright guys, thanks for tuning in to this month's episode of People Say the Darndest Things Coming Out of Anesthesia. I'm your host, Dr. Hassan, board-certified trauma anesthesiologist. We're going to watch 5 viral TikToks in real time. I'm going to react with you. I'm going to throw in some tidbits, some nuggets of information, why it's happening, when it's happening, how long does it last. So let's get into it. Before we start, if you guys can, please like and share. I try to make these videos in my spare time. I'm a full-time anesthesiologist. I'm a full-time father, full-time husband. So I would really appreciate it if you could like, subscribe, and hit the notification button. Let's get into it.
Kid under anesthesia making everyone laugh.
What? Take your time. Drink it right.
I love it when kids come out of anesthesia. They say the funniest things. This kid's got some pizzazz.
You just gotta leave it on the line.
So kids, why do kids react so differently to anesthesia? It's because they don't process the medications that we give as well and as fast as adults. So it tends to linger. So even after the surgery is over, the anesthetic meds, especially the benzodiazepines that we give, cause a decrease of inhibition. So think of it as kind of like alcohol. It creates a sense of comfort, and kids will say whatever. Kids will say whatever anyways, but you know, with anesthesia, they'll say anything. All right, let's do the second one here.
Let me see your bracelet really quick. I'm gonna take a picture.
No, I'm okay, thanks.
I'm just gonna scan it. Look, it's like a laser beam. Pew, pew, pew.
You know, if you
Look at
wanted
that
to take
face.
pictures of me, you could have just asked. God, like, how difficult is it to ask? Like, you just be like, can I take pictures of you? Why does everything feel like it's spinning? Is this a dream?
Spinning.
See you later. Take care, okay?
I'm leaving?
No, I'm leaving.
Oh my god! I want to leave.
Me too.
What did you dream about?
I dreamt about all this but spinning.
Oh, were you eating Taco Bell?
No.
Oh.
I was in here looking at you, bald guy. And you.
I wasn't in here.
You weren't?
No.
Yes, of course we will.
Whoa! Oh my god, the world's spinning! Why are you guys laughing at me? It's not funny. I can't tell if I'm awake or if I'm asleep. Can you tell
She's
me?
actually hilarious. She's gonna be
I'm
a
awake.
comedian.
Yeah.
Definitely.
Definitely.
Not a dream, right?
Not a dream.
Not a dream. And I'm good to go.
Not yet.
No, I need
remember-
surgery.
When you remember how you usually talk, then maybe you can go.
I talk like this, babe. But yeah.
Actually really funny because she has the after effects of midazolam and probably some other anesthetics as well. I don't think it's pain medication because pain medication causes you to sleep. So more than likely this is an after effect of the midazolam she got and maybe a couple other medications that are still lingering in her system. That's why she says the room is spinning. Like I said, this is kind of just like alcohol. Her receptors have not been inundated with years and years of drinking alcohol, and that's why the effect that you see is so much more pronounced and hilarious, absolutely hilarious. All right, video number 3, let's see it.
Don't say that. Don't say that. Don't say that.
Hey, girlfriend. Hi, girl. How you doing, girlfriend? I'm doing fine, girlfriend.
Girlfriend.
What you gonna do now, girlfriend?
Putting this on the end of here, that's all.
On what?
On this.
Okay, baby girl.
Okay.
Yeah, honestly, kids say the funniest things. I love it.
Man, I love you.
Hey, you. Calm down.
It's so funny because when kids say,
Your feet are oily?
Hola.
it's so funny because when kids say act like adults during videos, it's because their inhibition has kind of been, removed. So they're acting out as if they feel comfortable.
Are you sleeping?
And that's why she's able to say whatever she wants and not be
You wanna
scared
bite
of it,
your
like telling
popsicle?
people to calm down.
No.
Just a little bite.
No.
I'm fine, baby. See, she wouldn't say that because as kids they feel apprehension to say things, but when you're under anesthesia, you say the funniest things.
You're feeling good, aren't you?
What's up, baby girl?
Yeah, honestly, kids will say the funniest things.
For Dr. Hollingsworth?
My name is Randy. I love my candy. My dad's name is Brian.
See, normally kids would be too shy to say this, but because she's under the influence of anesthesia,
You are pretty. Your name is Nanny.
I am so silly. I have nothing to add to that one. It's just hilarious seeing kids lose their inhibition, lose their shyness, and say what comes to mind. All right, video number 4. Let's do it.
She'll get upset if she sees you touching me like that on my chest.
Oh my god, look at his face.
So, am I supposed to be itchy?
Called normal.
I've never been called normal.
This is funny because you can tell this guy's an honest dude, super devoted to his wife.
Do you smell that?
See, people will say, I love crawfish. People will say the most unhinged things when they are under anesthesia.
I could eat it all day.
But he's actually,
No, I don't.
because we're poor, see, he's speaking the truth. It's a truth
And it's
serum, honestly.
expensive.
Some of the anesthetics cause people to say the truth, what they really want to say.
Crawfish is a delicacy.
Crawfish
I
is a
can't always
delicacy.
afford it.
So this is definitely from the South, this video, because nobody eats crawfish except for like Houston and Louisiana. They call them mud bugs.
Like I'm saying the Pledge of Allegiance. I pledge allegiance
I pledge allegiance to
to
the surgical
the
hospital.
United States.
So he's probably at an outpatient surgery center. I love that. You can tell that gentleman right there is devoted to his wife because the first thing he thought of was, I don't want to upset my wife when another woman is touching him. So that's the truth serum coming out. 100% with this man. He is absolutely devoted. Number 5, best for last. This one is called The Kid with the Riz.
My nurse, my paramedic hella cute, yo. She hella cute, yo. She hella cute.
Definitely from the West
Hey, yo, what's
Coast,
your name?
California.
I'm Owen, bro. Hey, you know the dap? Hey, yo, watch this.
You see what he's puffing on there? That is a Pentox. It's a portable anesthetic. It gives you the feeling of being, under anesthesia without being under anesthesia. It's kind of like nitrous oxide, but more concentrated. But it causes. You can see him puffing on it. Oh my god! They usually they take it out of their hands. Yeah, exactly. When they get to the hospital, you don't need Pentox when you're at the hospital because you can give IV medications that are much better. But
Throw it up, bro. Throw it up. Just go like this, bro.
this kid is having a fantastic time. I don't know. It looks like he has a leg injury, if I'm gonna guess, from how well his arms are moving. So he probably broke his ankle or something like that. So you get Pentox when you have a orthopedic injury, typically.
Do you have a garbage bag full of protein?
Yep.
You can see the EMTs. EMTs are loving it.
Just spilled everywhere.
So I'm saying protein. So yeah, he's definitely in another dimension. He looks like he's in a different dimension.
Our stretcher's gonna smell delicious.
So more than likely, he got some benzodiazepine, and then he also had the Pentox. The Pentox wears off pretty quickly, so it only lasts 20 seconds after each inhale. So he has some sort of medication that's carrying him, and the Pentox is giving him the spikes essentially that cause him to have those funny reactions. I love that video because obviously he was in a lot of pain when they probably first met him. EMTs do a fantastic job of treating very traumatic injuries on the field. Pentox, the medication that he's using, plus the pain medication he probably got. He probably got some benzodiazepine as well to help him calm down. I love it. He's in a great place. This has been a fantastic set of 5 videos. What'd you guys think? Leave me a comment below. If you like this type of stuff, I'll do more of it, but if you can, please like and share.